Welcome and thank you for choosing the Mission Ultra Cholesterol Monitoring System. This system is designed to measure the total cholesterol level in fresh fingertip capillary whole blood. The Mission Ultra Cholesterol Monitoring System includes 1 meter, 1 manual, 1 quick reference guide, 5 test strips, 1 test strip insert, 1 code chip, 1 lancing device, 5 lancets, 1 lancing device insert, 3 AAA batteries, 1 carrying case, 1 warranty card. Installing the battery. To install the battery, turn over the meter to locate the battery cover. Press in the direction of the arrow on the battery cover and lift the cover to open it. Insert 3 AAA batteries into the battery case and note the direction of battery. Close the battery cover and make sure that it snaps shut. Meter setup before testing. To begin initial setup, the meter will automatically turn on after the batteries are installed. The meter will display the date and time setup screen. First, set the clock to either 12 or 24-hour mode. Press the M button to switch between the two settings. Press the S button to save the setting. The year will appear next at the top of the display. Press the M button until the correct year is displayed, and press the S button to save the setting and proceed to the month. Press the M button until the correct month is displayed, then press the S button to save the setting and proceed to the day. Press the M button until the correct day is displayed, then press the S button to save the setting. Once the day is set, the hour will appear at the top of the display. Press the M button until the correct hour is displayed. Press the S button to save the selection and proceed to set the minutes. Press the M button to set the minutes. Press the S button to save the setting and proceed to audio. Press the M button to switch between turning the beep function on or off. Press the S button to save the setting. Audio is turned on as the initial default. The meter will give 1 short beep when it is turned on, after specimen detection, and when the result is ready. The meter will sound 3 short beeps to sound a warning when an error has occurred. Coding the meter. Compare the code number on the code chip with the code number printed on the test strip canister or foil pouch label. With the meter turned off, insert the new code chip into the code chip slot of the meter. Turn the meter on by inserting a test strip. The code number will appear on the initial screen after startup. The meter will automatically turn off after 4 minutes of inactivity. Performing a quality control test. To perform a quality control test, press the M button to mark the measurement as a control test. Both the blood drop symbol and the control solution symbol will display. Gently shake the control bottle and squeeze to discard the first drop. Squeeze out a second small drop on a clean, non-absorbent surface. Touch the specimen tip of the test strip to the control solution drop. If the audio option is turned on, the meter will beep to indicate a test has been started. When the countdown reaches 1, the meter will display the control result. The control result should be compared to the control range printed on the test strip canister or foil pouch label. If the control result is within the control range, the Mission Cholesterol Monitoring System is working properly and the procedure is being performed correctly. Slide the strip ejector to eject the test strip. Performing a cholesterol test. Step 1. Collecting blood specimen. Unscrew the lancing device cover from the body of the lancing device. Insert a sterile lancet into the lancet holder and push it until the lancet comes to a complete stop in the lancet holder. Hold the lancet firmly in the lancet holder and twist the safety tab of the lancet until it loosens. Then, pull the safety tab off of the lancet. Carefully screw the cover back onto the lancing device. Avoid contact with the exposed needle. Make sure the cover is fully seated on the lancing device. Adjust the puncture depth by rotating the lancing device cover. There are a total of 6 puncture depth settings. To reduce discomfort, use the lowest setting that still produces an adequate drop of blood. Use settings 1 and 2 for delicate skin, 3 and 4 for normal skin, or 5 and 6 for calloused or thick skin. Pull the cocking barrel back to set the lancing device. A click may be heard. The device is now loaded and ready to obtain a drop of blood. Uncap the canister or tear open the pouch and remove one test strip. Insert the test strip into the strip port with contact bars end first and facing up. This will turn on the meter and display all the display segments. Check the display to confirm that all the display segments turn on. Make sure you recap the canister after you're done and write down the date on the canister if opened for the first time. Discard the canister and strips after 3 months from the date the canister was opened. Step 2. Testing for total cholesterol. Massage the hand from the wrist up to the fingertip a few times to encourage blood flow. Clean the testing site with an alcohol swab or soapy water and then dry the testing site thoroughly. Hold the lancing device against the side of the finger with the cover resting on the finger. Push the release button to prick the fingertip. Gently massage from the base of the finger to the tip of the finger to obtain the first drop of blood. Wipe away the first drop of blood. Apply light pressure to obtain a second drop of blood. Do not excessively squeeze the finger. Touch the blood specimen to the specimen tip at the end of the test strip when the test strip and blood drop icons start blinking. Do not apply the specimen to the front or back surface of the test strip. Do not press your finger against the test strip. Apply the blood drop to the specimen tip of the test strip until the check window is completely full and until the meter begins to count down. If the check window does not fill up completely and meter starts countdown, do not add more blood to the test strip. If an E05 message is displayed or the check window does not fill, discard the used strip and retest with a fresh test strip. Once a sufficient specimen of about 4 microliters has been applied, the meter display will count down from a calculated number to 1, and then the result will be displayed. If audio is turned on, the meter will beep to indicate the measurement has started. Slide the strip ejector to discard the test strip. Please follow proper precautions and obey all local rules when disposing of blood samples and materials. Viewing stored records. To view stored records, press the M button one time to turn the meter on and a second time to enter memory mode. The most recent value and the word MEM will appear on the display. Press the M button to recall the second to oldest record to be displayed. If the current record being displayed is the only record, then this is the latest record being displayed. If you are using the meter for the very first time, the meter display will show 3 dashed lines, the word MEM, and the unit of measure. This shows that no data has been stored in memory. Press the S button to turn off the meter. Clearing the memory. Extreme caution should be used when clearing the memory. This is not a reversible operation. When the meter is off and the M button is pressed and held for 2 seconds, the MEM symbol is displayed and DEL is displayed on the large display. All the records in the log can be erased by pressing M and S buttons together and holding for 2 seconds. The meter will display the words MEM and 3 dashes to indicate that the memory has been cleared. The meter will automatically turn off after 2 minutes with no operation or after the S button has been pressed. Maintenance. For best results, the meter should be cleaned after each test. Use a damp cotton cloth only if necessary. A dry, soft cloth may be used to clean the LCD and the strip port area. It is recommended that the meter be stored in the carrying case after each use. Take care to avoid getting liquids, residue, or control solutions in the meter through the strip port, code chip slot, or USB port. Remove strip port cover on the strip port by pressing in the direction of the arrow on the top of the meter. Wipe the strip port surface and gap carefully with a damp cloth or a mild detergent, and dry it with a dry, soft cloth. Firmly put the cover back on the strip port and push it in until it snaps into place. Troubleshooting. This table displays some of the errors you might encounter and the actions you will need to take in order to solve the problem. Please refer to the user's manual for more detailed instructions. The Mission Ultra Cholesterol Monitoring System offers accurate and precise results at your convenience. Please refer to the manual for detailed instructions.